This is a very exciting time in this space for many of us who have had dreams and visions of digital health. And I, as a personal observation, approaching 20 years of this pursuit, I think it's truly a time that we're about to experience that inflection point, that hockey stick that many of us have anticipated, and yet seemingly it never came to fruition. I think there are a number of aspects that are driving this, not the least of which is all the advancement in mobile and wireless technology. And a company that I work for at Qualcomm Life has had a lot of involvement in that. But I think this morning what we're going to do is have a good conversation with a few of my friends here. First with Dr. Richard Migliori, who's the Chief Medical Officer of UnitedHealth, and Marco Paluzzo, who is the founder and CEO of Cardio. And just get some perspectives on where we're at, where this is all going, what are the potential barriers, what are the accelerators, and at the end of the day, what I think we're starting to understand is that healthcare, like many other sectors in our society, whether it's the travel industry, the banking industry, shopping, is in the midst of experiencing this massive transformation of going from analog to digital. And that means connecting the dots and connectivity. We talk about it now in terms, especially the theme that you're hearing at CES this week is the Internet of Things. And Dick, is this the Internet of medical things that we're starting to see?
Thanks, James. When you start looking at what technology has enabled in medicine, and I think for the three of us, we'd be able to recognize it, is that all of a sudden the world got bigger, but at the same time closer. By having technology that allows us to connect, a physician sitting in practice has a better idea now about what their patients are up to, how compliant they are with given instructions, and what confidence and what kind of progress they're making. The other thing that it helped us to do is to help recognize that when we talk about the healthcare system, it's not the exam room anymore. It's beyond that. It's what's happening in the home. It's what's happening in the community. It's what's happening in institution. And it's what's happening amongst the various players that are involved, whether you're seeking care, whether you're paying for it, or whether you're delivering it. And when you are delivering it, who else is collaborating with you in this environment? And so when you start looking at technology, it's really allowed for four things. Number one, better, faster, and more accurate diagnoses at a deeper level of sophistication. You start thinking of tumors and a variety of other things. You start realizing, because of the genetic code and the like, what technology has enabled us to understand about the disease and all of its manifestations, and how that helps to make the diagnosis. The second thing it does is it helps us by making us better able to understand what is the best solution. For instance, technology allows us now to do a better job of doing comparative effectiveness treatment. Looking at variety of solutions and methodologies that have comparative value, as well as comparative differences as to who does those various techniques even better. The third thing it does, and it does it for both consumers in that exam room, don't equate the word consumer exclusively with patient. There's another consumer. It's the person in the white coat. And they're both struggling to get technologies for better knowledge, but most importantly, what they struggle with is to make sure they're making the best decision. And then the final area is to be able to stay connected as somebody migrates through the healthcare environment. So there's not just intensely focused on the exam room, but the home, the hospital, and all of the transitions amongst those three areas.
I think those are the key issues and the key attributes. You know, as a cardiac surgeon and as a transplant surgeon, Dick, we've had patients for years tell them to buy a blood pressure meter, go home and measure your blood pressure, and so what? 6 months later, they come back to the clinic, and we all get to see what your blood pressure was 3 months ago when you needed some help. You know, so Marco, we're really all about now. It's not just the ability to make these measurements, but it's connecting them to the people that need to know what's going on with you so that they can take better care. Does that include who does that include, and how does that happen? What are the issues around privacy and that information flowing?
Absolutely.
You've got
so
blood pressure meters.
Richard used one very important word, collaboration, right? And so who are, you know, there is definitely the patient or consumer, there is definitely the doctor, but then what role does the pharmacist play into this? What role does the family around the patient play into this? And so one of the important things that digital health is doing is really creating the tools and the environment that are facilitating all these actors that traditionally are not necessarily part of the healthcare process into the healthcare process, right? And that's opening up a whole new range of possibilities in facilitating untapped source of energy in the healthcare process, right, and to drive outcomes. And the other important thing is that technology for a long time has been driving, helping health to dig deeper, understand better the problems. But what's happening now with new technologies that the likes of Qualcomm are creating is actually creating the technology is now creating the opportunity to collect more data rather than deeper data, right? And so the value of collecting 300 blood pressure measurement a year rather than 5 blood pressure measurement a year, right? So you're still talking about blood pressure, right? But you can have a lot more information, you can act a lot sooner. So by introducing innovation that facilitates people in taking care of their health more often, more constantly, really, it's really transforming the equation of healthcare. So I think those are two important points, and at the root of all the kind of key enabler of all these that you're mentioning, privacy. You know, privacy, it means many things. Right? There are some legal and regulatory hurdles that kind of define the playground for what privacy must be, but there are also expectations that patients and doctors have as consumers, right? And those hurdles, I think, frankly, from my point of view, are even higher than what is set at a regulatory and legal level, right? And so I think in one way, the more consumer-driven spirit of digital health is in fact driving also these fundamental blocks of the tools that connect the dots.
Beautiful. So we've got connected home pregnancy tests now. We've got connected inhalers. I'd love to hear from both of you. What is it going to take now? Two things, and I hate to call them barriers, but what's in the way of the medical community embracing these things? Because there is a trust issue, there's a clinical accuracy issue. What's the tipping point for pharmacists, physicians, and nurses to embrace taking care of patients without actually seeing them. That's a big change in how we were brought up in medical school, because you had to put your hand on the patient in order to take care of them, and it was almost unethical if you didn't examine the patient before you made a treatment. So let's talk about that. And then secondly, you get doctors and nurses trusting it. Who's going to pay for it? So love to hear your perspective on both of those.
So let's start off with the first one. What's the big hurdles? For any technology, for any change, and I don't care if you're a physician, a lawyer, a consultant, whatever, it's always going to be around the issue of, does using this thing make my job more effective? Simpler to do, more effective in its outcomes, and does it provide me with confidence that the actions I'm about to take are the best actions? And I think that's been part of it, has been, can you show me it's going to do it? Otherwise, they're going to look at it and say, this is just one more task that's being thrown on to a heap of tasks I already have.
A burden.
Right. The second thing is the way in which we pay people. These kinds of devices are going to make it so that people don't have to have the hands put on them. Rather, you can have even more accurate assessment remotely. The current healthcare system doesn't pay anything for doing things remotely. Whereas as you start watching the transition in reimbursement policy where physicians are paid for outcomes, or they're paid for the care of a population, provided that that population reaches certain health status goals, etc. Then you start recognizing the system rewarding people for working smarter with those kinds of devices. And when you start thinking about it, this represents the major transition that we watch in the relationships we have with over 855,000 physicians that will pay some $100 billion a year to for their services. And that is the transformation of going from a fee-for-service environment to one in which is value-based payment. And the major transition that happens in the physician's mind is very simple, and I can remember it myself. It's walking out into your waiting room and worried about all the people that are there, and can I get through the day? Now the focus is worrying about who isn't there and who should be there. And devices like this help physicians prioritize who is the most ill and people who need the most attention most promptly by being able to predictively identify those people at greatest risk and allowing them to meter their day in that fashion.
Thank you. That's beautiful.
I mean, I think it's really all about, I think the trust issues are, we go away organically. The first computers, back in World War II, when they were doing the calculation, that they get humans double-checking the computer calculation because they didn't trust them, right? The first digital ECG devices, right, to be carefully checked against the traditional analog ones. So those things go away by themselves after a little while, but as the moment you start looking at doctors as well as consumers, and in kind of the mindset, the process they have to go through, then you start seeing that when you show them the advantages that they have, that kind of completely transform the pictures and how they are looking at things. I think eliminating unnecessary routine checkups is really one huge transformative factor in terms of cost, in terms of resources necessary to deliver healthcare. So the moment when you go to the doctor and the doctor tells you, measure your blood pressure, come back in 3 months, and then let's see how your medication is working for you, right? It's just creating a lot of routine checkup visits. I think in the US, there are 360 million doctor office visits just to measure blood pressure, right? And in 160 million of those visits, blood pressure is normal, right? So they are completely unnecessary, right? So imagine if these people could monitor themselves at home, perhaps more often, well, definitely more often than they do if they only do it at the doctor's office, and save time for the doctor and resources for the healthcare system, so that the people that actually need to take care of get to see the doctor, get in front of the doctor when it's the right time, right? Which is not necessarily the case today.
I think that raises a really, really important point for everyone here that's interested in digital health, is the fact that, careful what you wish for, now you've got all these devices that are connected. Well, wait a minute, I don't want to look at 1,000 blood pressure measurements flying at me every day. Really? Who's going to look at that? So what you're just bringing up is so critically important, is it's the combination of connectivity, especially in healthcare, with something called exception management. What you want is to use the technology to show you those patients that need your attention, and to be able to distinguish and discriminate from those who are doing perfectly fine. Then that'll allow us as clinicians to be able to spend our more valuable time on the people who actually need the attention. But this is interesting. It's not as much the technology as it is an entire behavior change on the part of our entire healthcare community to literally practice medicine in a completely different fashion than we ever had before. It's complete retraining, if you will, and it's very much like you look, again, across any industry, whether it's the travel industry and what travel agents used to do, but versus right now, or banking and so forth. How do we train an entire healthcare system to go from fee-for-service to value-based care and be happy if all their patients are doing fine and they don't need to see them in the clinic? They win.
Well, I think you have to train people when they really are resisting that. They need to be shown how something needs to be done, because otherwise it will not be obvious to them. I think the beauty of technologies today is actually that showing doctors the advantages of how their life could be made better, saving time, being able to do their job better at the same time with the less effort. It's something very attractive to them. So you don't need to, then you move away from the need to actually really impose on people how to deal with things in a different way, but they naturally flow to that different way of doing things, right? One of the things that we're doing at Quario is actually providing a doctor dashboard called Quario MD that actually gathers the information coming from all our sensors and allow the doctor to drill down on the single patient, but also to look at which patient need attention. So every morning, in a few minutes, the doctor or the other people in his team can see who needs to be called up or messaged because something may be off, or is even simply who has not been logging a measurement in a long time.
Well, Dick, the technology is pretty much at our fingertips now. How long will this take? How long does it take for the medical community and the payer community to retrain, for the payment incentives to get aligned? Is this 1 year, 3 year, 5 years, or are we 10 years out before we realize this new world?
I think it's sooner than that, and I think it's because we've all become smarter enough to recognize when you talk about the health system, the patient is a part of it too. And so when you start looking at it, you start looking at these technologies and those metaphors you have on the table, the real active devices, but they start uniting that whole system around a common goal. Who doesn't want their asthmatic patients to be healthy enough so if you're the plan sponsor, they're at work, they're focused at work, or if it's their child with the asthma, that the worker isn't being distracted by illness at home because they're confident the kid is doing well. If you're the patient themselves, your ability to feel well, you really have a greater outlook on life, the ability to save your finances because you're not going to the emergency room with issues of status, etc. And if you're the physician, to have confidence that somebody is following your orders and that you know that somebody is doing it. These kinds of devices are allowing us to look at two things, one of which is adherence. Is somebody doing that thing that I asked, whether it's this or weight loss tracking from activity, etc.? And then the second thing is, are they making progress? And by having three parties, the people who seek care, the people who pay for it, and the people who deliver it, sharing a common goal, united by common technology, and then sharing in the information, and then sharing in the financial reward, including incentives to the consumer, then you end up in a circumstance where there's a reason for everybody to go there. It's catalyzed by a little bit of money, but everybody is looking synchronously at the same objectives through the same portal.
Actually, you just threw a softball out there. I have to catch it. You talked about incentives. Right. I'm really pleased to actually make note of the fact that on this stage exactly 1 year ago this week at CES, we had our colleagues from Walgreens up on this couch, and we announced an intention to build out and develop a connected solution that would allow people to earn balance rewards points in return for their connecting their blood pressure measurements and their activity measurements. And our colleagues are probably here in the audience from Walgreens, and that program went live this summer and has been remarkably successful, with literally hundreds of thousands of people being able to earn balance rewards points, which translate into literally dollars of cash that they can shop at Walgreens with. Dick, are we seeing the same types of things with health plans and incentivizing employees to not only wear wearables, but actually to commit to doing activities and being rewarded for that?
Yeah, we're in the position now of actually trying to calculate the actuarial value of a step taken. Because now we have devices that can measure those steps. And it's no longer the stuff where the doc says, well, why don't you go home and do exercise, and I hope you come back and look at your change in weight or change in blood pressures every time you do it. You can measure them. Well, if you can measure them, can you start tabulating them and break it down as daily objectives that people can be inspired by, so that they internalize a set of activities, leads to a specific outcome. That outcome makes your life more enjoyable. And by doing that, and then catalyzing it with financial incentives, giving back to the consumer value that they created because they've internalized the motivation to be doing this work, then the technology has enabled us to play a variety of strategies to be able to affect better outcomes at lower cost.
Mm-hmm. Really, is the technology helping us align incentives, and everybody has a bit of a gain share almost out of being successful?
Yeah, let me give you a case in point. I remember telling patients who were diabetic in my practice, I'd like to see your daily weights. Okay, and so you give them a logbook. And they'd come into the office and the logbook would be handwritten. It was rather interesting because every day was the same pen. And it was all in the same line. So what I decided to do is, in my exam room, I put green pens around the place, and what I started seeing is when they came into the office for their exam, not only were the numbers looked to be the same pen, but they were my color green. So they were filling these things out in the waiting room. By having these tools, we have the ability not only to see what kind of progress is being made, but what might be interfering with them making that progress. What happened during this week that you weren't able to participate in your care or to drive your health status? And you can have those kinds of meaningful conversations. It's a great eye-opener for the physician who's locked in their office, seeing one patient after another to know exactly what's happening outside.
But I mean, also the patient, the patients themselves, they can start to see how changes in behavior affect and drive
Exactly.
what's happening to their blood pressure and to their weight and so on, right?
Make the direct connection.
Yeah.
Right.
And by the way, I don't think that these two are separate and parallel tracks. I think they combine. We are, Quality is a partner with Walgreens Balanced Rewards Point. So when you measure your blood pressure or your weight with our blood pressure monitor and with our scale, you earn points, but at the same time, that information goes also to the doctor and to the family members if the patient likes, right? So other people can, everybody, the patient, his maybe daughter and his doctor can all see what's happening and what kind of behavior is really driving those changes.
Well, I think we're coming down the last few minutes. I'll try to summarize some of these observations and conversations. I think we're really at the precipice of a transformational change in healthcare, the likes of which we literally have not seen in 100 years of traditional care. It has a lot to do with many circumstances. Obviously, technology has evolved to a place where these things can be, inexpensive and even disposable. Our payment system is moving from fee-for-service to value-based care, which aligns incentives. We have a consumerism of every other experience in our lives that are now digital, but for healthcare. So healthcare is the last standout of that. But I think we do have some last challenges ahead, and that's really the learning and the behavior, the clinical pathways, outcomes, and demonstrating where the value of these things actually is measurable. Any other observations, gentlemen, before we close? We've got about a minute left.
Well, I think one important point that we should, in summarizing everything, is to mention that also the regulation is evolving in a supportive way, right? Regulators are getting increasingly in tune with these changes and increasingly see the benefit they're having from introducing these newer technologies into devices and into the market.
And the clinical accuracy and medical grade is going to matter, so doctors and nurses can make, life and death decisions in some cases on this information.
Well, the cornerstone of this revolution continuing on its track is maintaining a high level of confidence in everybody about the reliability, the quality of the devices, the measurements, the data integrity.
Absolutely. And Dick, I'll give you the last word.
Well, thank you. In the past, I remember when we listened to Jill earlier, watching this conference grow over the years. When we first started talking about this thing, the rate limiting step, the limitation we had was the availability of technology. Now it's not technology, it's behind. Technology is way out there.
Yeah.
Now those who pay for health care, those who deliver it, and those people who are seeking it have to get themselves at a place where they're taking full advantage of what's already there.
With that, we'll wrap, and thank you, gentlemen. It's been a pleasure.
Thank you so much. Great session. Thank you.
Thank you.